So today we're going to deal upon what is binocular vision, types of visions, and what could be the major advantage and the advantages of BV, and what are the grades of BV will be seeing on. So basically, binocular vision is nothing but it's when your both eye left and right is getting a different image, and it's going to club it up and giving you a single vision. It's called as binocular vision. So today we'll be seeing on what is types of vision, what do you mean by binocular vision, neurophysiology little bit, and milestone of BSV, and what are the major prerequisites which is needed, and what are the requirements for BV, and what are the grades that is being needed in BV, and advantages of BV. Before going that what is BV, we'll see what are the types of vision which is being there. Monocular, biocular, and binocular. Monocular is nothing but when you view an object in only in single eye, it's called as monocular. Biocular is something like when the both eye has a different image but unable to coordinate that image into a single one, it's called as biocular. Binocular is something when your both eye is seeing a different image and it's clubbing up together and coordinating an image and giving one single image. That's called binocular. Basically binocular is nothing but when a different like when two different eyes sees and two different images, and when the this thing binocular, when the two images been clubbed together and information is sent to one brain, that gets informated and then that produced into one a single image. When the two eyes is getting individually fixes in that area, the visual attention has been placed, and then that is going to give you a single image. So basically, to be like make it up in a short form, it's called as coordinating of two eyes to in order to produce a single image. Little bit of neurophysiology based upon the binocular vision. The main structure which is providing BSV is nothing but the optic chiasma, and then the neurology pathway which is very important, and with the cellular which has been important and doing a major role is paracellular and magnocellular, and these are the structure cell which helps in passing up the information and making up the BSV in a correct form for an individual. So basically what happens in milestone of an BSV development, so it takes some time. So as child has been born, it has been born with vision, but it doesn't get stimulated up. So as while the days goes by and weeks goes by, the child at the week of 2 to 3 weeks, the child gets infant stems is air to fixate an object, and then at the fourth and fifth week it makes sustain the binocular fixation and for only for the near objects. And when it crosses past 1 to 3 months, when the two different images is being seen by two eyes without any sort of a confusion, without any sort of an overlap, the single image has been produced. And at the 3 months, binocular fusions will be using two eyes. Binocular fusions will be fused. At the 6 months, the stereo of depth will be developed for a child. The prerequisites for the development of BV is what are the requirements in order to make it up for a BV binocular vision. What are the components and what are the things which is needed for an individual? Its first thing is the fixation, and next prerequisites are the visual fields, and then image formation. And the image formation should have a common visual direction, and reflect activity is nothing but fusing of that image. So, in order for an individual to get a normal BSV requirements, the three criteria should be made up. So, if a person has a clear visual access and ability to like make a retina to like focus on the two dissimilar image, that is for sensory fusion, and then coordination of both eye, it is very important. The major components or the major grades of BV are into three classification, depending upon the what classification. BV has been divided into, classified into three stages: simultaneous perception, fusion, and stereopsis. Simultaneous perception is nothing but when an eye is able to get the signals has been transmitted to two eyes, and when that has been perceived simultaneously by your brain, and the picture is been getting perceived by the brain, and the ability to the individual to appreciate that image is said to be a simultaneous perception. So this is generally done when your eye is been getting two dissimilar objects simultaneously. So this This is the illustration, the cage with a dog, and one is missing. The cage is separate. The right eye sees your cage and the left eye sees your dog. And when the information is being passed to your brain, when this is being observed on simultaneous by both eye, you'll able to make it up into a the cage. Inside the cage the dog is being present. Fusion is fusion is been defined as when you have like when you see a two images when get fused together and maintain it in one singular image, that is called fusion. Mm, so the fusion for testing a fusion or seeing a fusion, this is the same thing with a rabbit with a flower. With the one is missing with flower and one is missing with the carrot or a bunch of a flower. So when this fuses together and produces a single image. And what are the main components which is being used for fusion? So one is sensory and motor. The sensory is the one which is going to maintain the images falls on the correspondent retinal points, and motor is the one which makes the maintains the image in order to avoid the diplopia mechanism. So stereopsis, as I said before, stereopsis is the one which is able to appreciate the 3D dimension of a particular image when we have when we see the image in a different angles. It isn't just an ability to fuse the objects and make it into a clear way. So it is also called as depth perception. In order to gain a more depth perception, stereopsis is the third grade, which is been in BSP. So these are the few illustration which makes you to like know in order to know the. So this is a narrow depth field and this is the larger depth field. This is how we work it up with the cameras and how we look. Even the RI has got stereopsis depth perceptions. So what could be the major advantage if an individual has this binocular vision in him? The first and foremost thing is the advantages is like the individual getting a single vision, by the way. And the next thing is like the vision gets sharper, the clear and more sensitive, very detailed information can be perceived by that. And enlargement of the field of vision by using a both eyes get more larger field of view. And then even the blind spot and other differences can be easily spotted out. Thank you.